medicine from Sri Lanka for COVID-19. The President of Sri Lanka, Mr. Gotabaya Rajapaksa, has trained State Minister Chanijaya Sumana to direct a legitimate assessment rapidly into the medication created by a neighbourhood Ayurvedic specialist in Sri Lanka to control the COVID-19 infection. The orders were given at the gathering of the COVID-19 task force which held on 1 December 2020. Ayurvedic specialist Damika Bandara had the option to build up a nearby medication to control the COVID-19 infection, and a primer examination was done with the intercession of a group of Western specialists. The medication was regulated to volunteers from the COVID-19 treatment centers in the home territories. The specialists say that the state of the COVID patients who were given the medication improved. State Minister of Indigenous Medicine Promotion Sisira Jayakodi, talking in Parliament on 30 November 2020, expressed that their consideration has been attracted to this indigenous medication. This medication has been a topic of conversation at the COVID-19 task force that gathered under the support of President Gotabaya Rajapaksa. State Minister of Drug Production, Supply and Regulation Chanijaya Sumana, who partook in the occasion, communicated his perspectives. The State Minister likewise remarked on the way in which further examination will be done on this medication. An extraordinary conversation was held on 2 December 2020 with the interest of the Minister of Health Pavitra Devi Waniretchi and 5 state ministers with respect to the medication created by a neighborhood specialist in Kagal to control COVID. Indigenous Dr. Damika Bandara, who built up the medication, was additionally present at the conversation held at the Ministry of Health in Colombo. The medication was controlled to patients who chipped in at the COVID-19 treatment center in Withupitiwala Hospital, and tests were completed on it. The medication was talked about at the task force meeting led by President Gotabaya Rajapaksa recently, and the President has educated that a proper assessment be completed with respect to the medication. The Minister of Health has called attention to that to make this prescription accessible to Sri Lanka as well. Regarding the entire world, examination should be done as per logical strategies, and an arrangement of proposition should be set up in such manner. A specialist board was selected to facilitate the planning of the proposition, and Professor Sanaka Pilapitiya was selected as its director. Minister of Health Pavitra Waniretchi partook in a preliminary to test a medication to treat COVID-19. Fundamental examinations have been led with the mediation of Western doctors on the medication created by Ayurvedic Dr. Damika Bandara. The government has concentrated on the medication as it had created positive results in the wake of being managed to chip in patients at COVID. Treatment focuses on bequests. An uncommon conversation was held under the aegis of Minister Waniretchi with different well-being ministry authorities on planning rules concerning the organization of the drug. The Health Ministry said a specialist panel was additionally named during the conversation to study and draft the rules on the privately evolved medication. On 8th of December 2020, countless individuals have rushed to acquire the neighborhood hostile to coronavirus syrup arranged by Damika Bandara. It is accounted for that in excess of 15,000 individuals have shown up in the Udumagama zone in Hetmala, Kagal in Sri Lanka. The police expressed that 120 police faculty have been sent to control the gridlock at the scene.